Good morning.
Good morning.
It is a pleasure really to be with all of you this morning for such an important conversation about maternal health and how we have a truly national imperative to improve maternal health. But I'm sure we can all agree that it's embarrassing, it's shocking, it's tragic that we're talking about rising rates of maternal mortality in the United States in 2018, especially when we know that maternal health is often considered such an important indicator of the health of a nation. But we're here today really with some incredible leaders, powerful women who are leading the way and leading the charge in addressing and improving maternal health, Mayor Bowser and Christy Burns, and really excited to have this conversation with the both of you.
Thank you.
You know, often we know, and certainly in public health, that there may be an experience or certain factors that motivate and inspire leaders to take action on an issue and make it a priority. And so I'd love to start with hearing from both of you about what has inspired you, what drove you to make maternal health such a priority and focus of the work that you do? And Mayor Bowser, if we can start with you.
No, absolutely, and thank you both for your work in this area. And for us in the district, it's an issue that we have certainly been focused on. And in talking with the doctors and stakeholders that work with women and families each and every day, they've always been concerned about premature births and making sure that women and families have access to care. I think my laser focus this year and kind of impetus for us having a convening of mayors from around the country was hearing Serena Williams' story and call in the points that she made. I think cut across socioeconomic and so many different experiences and her focus on the particular impact on African American mothers who are getting access to care and fighting to be heard. And that in our city, I wanted to make sure that we looked at that experience and used it to talk about women who aren't multimillionaires and world-class athletes that have access to the best care, but had the very same experience.
Absolutely. So that power of story and certainly utilizing that power of story, but then being able to say, how does this affect the everyday mother and everyday woman? Absolutely. Christy,
Yes, for me, it was a very personal experience that led me to this work. When I became a mother in 2003, that was the day I became a global maternal health advocate. After delivering my daughter, I hemorrhaged. And before that experience, I really wasn't aware that the rates globally were what they were, let alone the United States, which was 41st at the time, and we've fallen back to 46th, I believe, today. So just learning that information and having that personal experience is what really led me on my path. It led me to pursue a MPH at Columbia University. It led me to make a film called No Woman, No Cry, which was the first film we made to put the faces against the statistics, right? These are human stories. When you hear the numbers, they're outrageous and they are embarrassing and they are shocking. But when you hear women speaking about their experiences and the providers who are trying to meet their needs and meet them where they are, to hear those perspectives, I think is such a powerful tool. So my organization was really founded after that film and after that experience to try to bring more people into the conversation.
So wonderfully, we're hearing from both of them about the power of story combined with the data to really be able to build the case and really build a narrative of how we take action on such a critical issue as improving maternal health. And data has been such an important theme and certainly a focus of this initiative and something that we've continued to talk about since the summit yesterday when it started. Dr. Sommer actually shared some of the statistics specifically in the US, but some additional statistics, and you both alluded to it, are the disparities, the racial disparities, for example, that we see in maternal mortality, with Black women experiencing rates 3 to 4 times higher than white women of maternal deaths, and where women of color generally have childbearing complications that are higher than white women. Can you tell us both how you've used data to really help inform the initiatives, the work that you're doing? How has that influenced that work, and in particular, the disparities and improving equity as well?
No, go ahead.
Well, the one of the initiatives that we're focused on, and I know cities around the nation are looking at maternal mortality review committees, so that in each and every case, we can examine what happened, if we know about causes, if we know about if it was in the, all of the issues around the providers and the experience, and that will allow us to have a dispassionate view of what happened to inform all of our practices and policies and procedures, and that's one thing that we're doing.
Yeah, and you know, as important as the quantitative data is, and which is what really sort of alerted me to the scope of this problem in the U.S. and globally, is really the qualitative data, and that's what we've been really focusing on at Every Mother Counts is through the storytelling, through the filming, through the documentation of experiences of both patients and providers, that we can elevate this issue and inform people who are, in some instances, have the ability to make choices around their healthcare, but in other instances, the people who are falling through the cracks of our healthcare system, to make sure that every mother, everywhere, has the same access to respectful, quality, and equitable healthcare.
Absolutely. So I will say this importance of the storytelling, we're seeing that here throughout the summit. Heard some incredible, for example, young people from Baltimore yesterday who told their stories as we were talking about the issue of power and connectedness in youth and leadership. Leadership, we talk about a lot in public health about the importance of leaders, not only at the federal level, but also locally, to be able to really impact change. And one of the things we know is that mayors have incredible influence in working with elected officials, in partnership with elected officials, to really raise awareness of public health as being a front and center issue that really requires attention, and certainly with an issue such as maternal health. Mayor Bowser, you launched a first ever summit on maternal and infant health in DC in September, and you brought people from around the country, given your platform as the mayor of the nation's capital. Can you tell us what was your vision for that summit, some of the outcomes, and what you hope moving forward that kind of a convening will be able to move with regards to?
Well, first of all, we were just blown away by the participation. So it's our first time. We honestly thought we would have a couple hundred people from DC that came to the convening. We started, I think, planning in May or June for a September summit, and the response was so incredible from physicians who came from around the country. Our Dr. Nesbitt leads DC Health, which is our health agency. She tapped her network of health commissioners from around the nation, and if people were available, they wanted to be there. We also tapped mayors, and what I know is our situation in DC is not unique, where we have great number of women of color who are insured. 97% of the people in Washington, D.C. have insurance, so we want to make sure they're using it. And so we had over 1,000 people come to that convening. Valerie Jarrett participated with us, as well as Kathy Hughes, who leads one of the largest urban radio networks across the nation. And so we wanted that information not just to be shared at the convening, but across the nation, and that was important. What Dr. Nesbitt and her team have done since then have happened smaller convenings of the stakeholder groups who were there, so that we can really lay out what we want to do moving forward. I expect that we are going to create, in addition to our maternal mortality review committee, also convene a task force on the buckets of work that we identified that we need work on in the city. And that will be an ongoing effort that will lead to our next convening, probably next fall.
That's great. Wonderful. Christy, your work at Every Mother Counts, it's global. Certainly you work here in the United States, but also around the world. And as we talk about leadership and the role of various sectors, we all have a role to play. You hear that message often, that not only in government, but other sectors have a role to play in improving health, including maternal health. Can you talk more about Every Mother Counts and what you view as the vision and the role of nonprofits and philanthropy to be able to actually improve maternal health?
Absolutely. I mean, I think foundations are really filling the gaps right now. I mean, we want to work in partnership with government, certainly, and in order for initiatives to be sustainable, you really need to think about that collaborative approach, and so we see that the world over. But I think for an organization like ours, which is still fairly small, we've been so focused on raising awareness, engaging the public, the people that aren't necessarily brought into this conversation or weren't when we first became a part of it, and then investing in community-led initiatives where the people that are in the communities themselves are going to have the best information and access about the needs of that said community. And so really getting behind those leaders and trying to give them the lift up that they need, because they know what's needed and they know how to do their job best. So it's been a great role for us to play. And then we play another kind of facilitatory role where we can bring different partners together. They can share their learning and experiences, which is so great about the convening and example that the mayor gave. We look to do more of that too in the future. I think this is a really important time for this issue, and we need to work together in order to really make sure that we're reaching everybody that needs reaching.
You both raised, really two important issues of community engagement and sustainability, because oftentimes when we're trying to actually do work in communities, often the community members themselves or community leaders may not have a seat at the table. How do we really talk about and advance this kind of work where we understand maternal health as a pillar in all communities, but where the communities themselves are truly meaningfully engaged, and we can sustain that work? Because sometimes it may not be able to cross administrations, or priorities may change for different organizations. How do we really embed this kind of a focus, for example, on maternal health in communities across?
I think that's a great question, and one that sometimes when you have a crisis situation, the reaction of government is to throw everything at the wall and see what sticks. And what and I confess, I want to do that sometimes too. But what's important in this work, I think, is looking to see what has worked in other places and making those investments. And that's what our department is focused on too. One very, I think, thing that I didn't expect from our summit was to see so many young women there, and women of the whole spectrum, with their kids. And what I was struck by is that we don't see these people who are in this room. I don't see them regularly. I don't see them at our community meetings in the evening. I don't see them down at council hearings. And this was an opportunity for them to be seen and heard and engaged. And I think that the way to keep them engaged is to, have some meaningful work in our task force. And the reason why I haven't announced it yet is because I want to make sure that we know what their agenda is, and it's going to mean something, and it's going to be able to deliver something. But also look at the initiatives that they are bringing forward, and see if they're saying this is what's going to work in our community, then line those activities up for investment as well. We heard the former administrator say a little bit earlier that our values are represented in what we're doing about health and climate change. And I would add that our values are represented by how we value women and childbirth. Why are women dying in our country giving birth? Given our vast prosperity and our technological advances and our expertise in health, we can, with the right focus and investment, really make a sizable impact on maternal health and infant health. I know we can do that. And you asked, what do mayors do in that regard? One thing that we're doing is, and we're going to look, you worked in the federal space, is make sure that our nation is doing what it should do. And that is reflected in making sure everybody has access to insurance. That is reflected in making sure that we don't experience the shortages in specialty care in vulnerable communities. That people have, if we have high-risk pregnancies, we know it, we need doctors that can address those pregnancies and make sure those communities have access to into that expertise, and we can do all of those things. It also means addressing families where we have them every single day for 8 hours, at school, at rec centers, and so that we are addressing whole families. And that's the challenge of local government, and calling on our federal partners where we need them, so that we have a champion on the Hill as well as in state houses and governor's office around our nation.
I know we're running out of time, but I'll just add one thing very briefly. One of the ways that we sort of bring those community members' voices to the forefront is through our storytelling. We have a series called Giving Birth in America, and we've sort of taken a state-by-state approach at what are the challenges and what are the opportunities. And so there's been phenomenal community leaders like Jenny Joseph in Central Florida, like Chanel Portia, who's in Bed-Stuy, New York. We've done this in California, Montana, Louisiana, and we're filming now in New Mexico. So trying to really get into the communities, bring the members from the communities through their patient care to really see them at work and to see how they're addressing those needs. But yes, that's it.
Wonderful. And while we don't have time to talk about it on the panel today, one of the things for you all to know is in addition to their work certainly in promoting high quality care and maternity care is also a focus on the social determinants of health and understanding that our health is so strongly influenced as well by the conditions in which women and families and communities live and where children go to school, and it has intergenerational effects. And the mayor and Christy are both also very focused on that emphasis in addition to ensuring that there's high quality maternity care for women. Well, please join me in thanking our panelists.
Thank you.